All right, so welcome to our Ed by VC Dermal. Whilst we're waiting on everybody to hop on, I'd like to just introduce myself and give you a little bit of background about my career and my history and VC Dermal clinics. So my name's Tracey. I've been in the industry for over 10 years. In that time, I've mostly worked in clinics that offer your advanced skin treatments, such as chemical peels and skin needling and LED, laser resurfacing, and laser hair removal. So that side of the industry has always been my passion, working with more clinical based treatments and always striving to provide results. I've been at VC Dermal clinics for 5 years, and there are so many things that I love about the company and the culture, but what I'm most proud of is our focus on education and training. So that really is at the core and the forefront of everything that we do, so that our therapists and our girls can be the most knowledgeable in their field and be able to pass that on to our clients to, not only provide amazing service and treatments, but to provide our clients with the results that they strive for when they come in to see us. And part of, always attempting to know everything and be the best that we can be, we're always engaging in online training and upskilling and education. So I'm really proud of all that we do. And, in the biggest sense, our network and community, we, align ourselves with companies like Lyra, who always offer ongoing support and education as well. So I'm very excited to be able to share with everyone what we know, especially via this social media platform, which is amazing as a way to reach out to everybody during this lockdown period. So in saying all of that, I think we could probably get started. Okay, so welcome again. The topic of today's webinar is going to be all about pigmentation. So just for future reference as well, if there are any topics that our listeners are interested in, I encourage you to reach out via our email address and let us know what you're interested in. Provide us with your details so that we can send you an invite to any future webinars that we do. This will be an ongoing monthly series, so we can invite you to anything that you're interested in. So as I mentioned before, today's topic is going to be all about pigmentation. When we're in the clinic, we receive a lot of inquiries with regards to this concern, which tells me that it's something that affects a lot of people, especially in Australia, where in the past there's been that culture of, lying out in the sun with the tanning oil. And now we're starting to really see the side effects of our sun-loving culture more and more. So what I hope that our clients will gain and our listeners will gain from this webinar is a bit more of an understanding about the types of pigmentation that they may have, and the navigating what treatment modalities will be best suited to them, because sometimes it's not a simple process, and the treatments or the pigment itself can be a little bit more complex, navigating what treatments will be most successful. The other special thing that we'll be doing tonight is at the end of the series, at the end of the webinar, we'll be giving away a Lyra Pro Light Serum, which normally retails at $98. So this serum is amazing. It's our go-to core product for any pigmentation concerns or disorders. And in my opinion, what makes it so special is that it has a very long list of ingredients, unlike any other pigment serum that I've seen before, which works on treating pigment in every layer of the skin. So that is an amazing product which we'll be giving away. In order to ensure that you go into qualify for this, just stay on till the end of the webinar, and we'll announce the winner of the serum. I'll also encourage that if you have any questions, please use the chat function. And again, at the end of the webinar, we'll go through them. Okay, so where is pigmentation formed? So in order to understand the formation of pigment, we have to go back to skin biology a little bit. So we have cells known as melanocytes, which are responsible for producing melanin, which is also known as pigment. Now these melanocytes sit in the epidermis, at the bottom of the epidermis where it meets the dermis. So we can't see these cells to the naked eye, they're quite deep within the skin. And what happens is inside of the melanocyte, we have a nucleus, and within the nucleus, we have our DNA. And our DNA is like an instruction manual, which tells that cell how to function and how much melanin or pigment to produce. This essentially gives us the color of our skin. Everybody has the same number of melanocytes, but what differs from one person to the next is how much melanin or pigment is produced within this one cell. Now, when we encounter pigmentation issues or disorders, what actually happens to that melanocyte is that it's triggered to produce an excess or an abundance of pigment, which is then carried along the cells through these octopus-like tentacles, which are known as dendrites, and it delivers the pigment to around approximately 25 to 30 cells around it. Now these cells then take on the pigmentation, and what eventually happens, if enough cells are affected, they eventually shift up to the surface of the skin as our cell turnover occurs, and the pigment will then become visible in natural light on the surface to the naked eye. The primary trigger which causes the excess production of that melanin is actually inflammation. And there are so many factors, both internal and external, that we'll cover in the next couple of slides that will trigger inflammation. But I always explain it to my clients that basically our skin, when it produces pigmentation, it's attempting to protect itself from whatever that trigger is that's creating that inflammation. I guess the easiest analogy to that is when we get a tan. So when we are out in the sun and we think we're looking all great with our tanned complexion, that tan is actually our skin producing excess pigment in order to protect itself from UV rays. So that's the easiest way I can think of to explain it. Okay, so what types of pigmentation are there? There are two main categories of pigmentation. The first one is hyperpigmentation. So hyperpigmentation refers to hyper meaning excess or too much pigmentation in the skin, and can be defined as a number of different forms. So the first and most common form that I would say most people recognize is freckles. So freckles is a type of hyperpigmentation and can come from excess sun or genetics. Another type of pigment similar to this is sunspots and age spots, which we tend to see in older clients after a lifetime of sun exposure. Another type of hyperpigmentation can also be defined as post-inflammatory pigment, which tends to occur after a trauma or injury to the skin, such as after breakouts or acne. From that trauma, you're left with a little bit of discoloration, and is typically much worse in darker skin tones. Another type of hyperpigmentation is also known as melasma, which is what's pictured in the middle illustration. So melasma is, again, a different form of hyperpigmentation. Generally, it's stimulated by inflammation from hormonal changes. So we predominantly see this during a woman's major shift in hormones, such as pregnancy or breastfeeding. And it does tend to occur more in clients with specific genetic backgrounds and ethnicities. It's characterized by larger sort of cloud-like formations on the skin, and it's normally very symmetric, so it'll always be mirror image. Now, the second type of pigmentation is known as hypopigmentation, and hypopigmentation is where there is a loss of melanin in the skin. So the melanocyte is so severely damaged that it totally loses the ability to produce pigment. And as you can see from the illustration on the left, this lady is experiencing these little white patches, and we would refer to that as hypopigmentation. And because of her skin tone, it's quite obvious. Now, hypopigmentation is often irreversible, but it's most familiar in conditions known as vitiligo or albinism, associated with conditions like that. So, what causes pigmentation? 85% of pigment occurs from extrinsic factors, and we would explain are controllable. So these can include UV exposure, trauma or injury, heat, inflammation, medication, inflammatory foods, or incorrect skincare. So they're controllable in the way that we have some we're able to eliminate them in order to help with preventing the pigmentation in the first place, with to some degree. Then 15% of pigment is formed from intrinsic factors, which are uncontrollable and refers to genetics, hormones, and thyroid conditions. So no matter what we do on the surface of our skin to treat the pigment, these factors we unfortunately can't change. So knowing what causes the pigmentation and where it's coming from is really important. I often refer to pigmentation as a jigsaw puzzle because there are so many pieces that need to come together in order to complete the puzzle. And it's really important that clients can adjust their expectation. We can never truly 100% remove your pigmentation, especially if part of the trigger causing that inflammation is uncontrollable, whether that come from genetics, hormones, or thyroid. So I ask clients to adjust their expectation to understand that our goal is long-term management, to lighten the pigment as best as possible, suppress it, and manage it in the long term from getting worse. But we unfortunately aren't able to remove 100% of the pigment. Okay, so what can you do at home to help your pigmentation? So pigment must be suppressed and repaired on a daily basis in order to adjust our melanocyte memory. So if you remember on that first slide, we talked about having the nucleus containing the DNA. Our DNA is predisposed to have a memory. So it's going to tell that cell to continue functioning the way it's predisposed to do. So in order for us to treat your pigmentation, we need to change that melanocyte memory on a daily basis. Often when clients start their skincare journey with us at their initial consultation, they ask how long they need to use skincare for. And my answer is always long-term, for your lifetime. So in order to have bright, healthy, even complexion, you need to be consistent and committed to ongoing skincare, remembering that our skin is our body's largest organ. So it needs to be fed and taken care of on a daily basis. So some ingredients that are proven in the treatment and lightening of pigmentation include arbutin. Arbutin shuts down the overproduction of pigment in the melanocyte. Kojic acid. So kojic acid blocks the transfer of pigment via those dendritic tentacle arms. So it helps to minimize the movement. Hexylresorcinol is a natural skin lightener. Hexylresorcinol is quite special because it's very similar in the way in which it works in functionality to hydroquinone without having the toxicity and the nasty side effects that are associated with hydroquinone. Then we've got vitamin A. Vitamin A normalizes the overproduction of pigment. You may remember from our acne webinar that vitamin A is the only ingredient that has the ability to pass through our cell membrane and actually get into the cell and communicate to the nucleus. So vitamin A is a must in all skincare routines. Then we've got vitamin C, which is also a skin brightener and antioxidant. Now we've got mastiha, which you may not have heard of mastiha before. It is a very, very special and exclusive ingredient to Lyra, but basically it's a universal anti-inflammatory and it helps to restore and brighten the skin. It's also great for cell immunity. So a lot of the skincare in Lyra has mastiha. And then lastly, SPF. So we always recommend the use of a physical-based zinc SPF in order to provide broad spectrum protection against all forms of UV. Now, what's really special about Lyra is that 98% of their entire skincare range contains skin brighteners and lighteners. So that's why it's my favorite range for the treatment of pigmentation. Okay, so what treatments should you be having in clinic? So generally, we always start by preparing your skin on the recommended home care. So you come in and we'll recommend what you need to use and you start using that at home for a period of between 2 to 4 weeks. It depends on your skin type as to the length of time that you need to use them. And just remembering that the purpose for that is that we're working on that melanocyte memory. We're working on preparing the skin, getting it into the condition that it needs to be in order to have in-clinic treatments, starting to suppress that pigmentation and normalize the functions of the melanocyte. So when you come into the clinic, we always perform at your initial consultation a Woods lamp assessment. A Woods lamp assessment is so important because it allows us to look at the skin in the dermal layer past the naked eye. So I use the analogy that pigment can be a little bit like an iceberg. So what we see on the surface is only very, very little compared to what may be lingering underneath the surface of the skin. And a Woods lamp will allow us to determine that. So it's really important to have that information before we move forward with your treatment plan so we can ensure we're recommending treatments that will provide you with the best results. Now, we also in your consultation ask you a long list of questions pertaining to your hormones, your medical history, your lifestyle, your genetics, and these questions are so important, and I hope that now, knowing the causes of pigmentation, clients who are watching will understand why we ask these questions, because it's so important to know that they all contribute to your pigmentation and as such will determine your end results. So once we've conducted a thorough consultation, we generally start with chemical peels and LED treatments. So chemical peels, we have 2 on our Lyra menu, which are amazing for the treatment of pigmentation. We usually start off with a Vitabright enzyme treatment, which as the name suggests, Vitabright, you get the gist of what it's doing. So it works on brightening the skin, hydrating the skin, and using a lot of anti-inflammatories to suppress the overproduction of pigment. Now, it's not a chemical peel in the way that you'll experience a lot of downtime or peeling. We can do this on anyone who comes in for their first treatment, and we like to combine it with an LED. LED uses non-thermal light, and it uses the light on a much deeper level than what the chemical peel can absorb, and the light works to minimize inflammation and hydrate the skin and just energize our cells so that they can function the way that they should. So combining chemical peels and LED together is a way that we can treat the skin as a whole approach on every level. Now, another peel that we use in Lyra is our lactic peel. Our lactic peel is great for brightening the skin. It also has pigment ingredients such as the kojic acid, which, as we now know, works to shut down the transfer stage of pigmentation. Once we've started with our LED and chemical peels, we can move on to laser photorejuvenation. However, it's important to know that this is not an option for all types of pigment. Generally speaking, laser photorejuvenation works best on freckles, age spots, and sunspots. They tend to be quite successfully reduced with laser photorejuvenation. However, types of pigmentation such as melasma and anything hormonal actually will not have a great result with laser photorejuvenation. So we tend to, the treatment plan for melasma will be chemical peels and LED, because we're working on long-term management of that type of pigmentation. As the trigger is internal, we need to work on suppression to provide you with the results. So it's important that we choose the right treatment for you based on the type of pigmentation that you have. So I am going to be reaching out to everyone after our webinar, just to discuss any individual circumstances that are relating to their pigmentation, and I'll be able to provide any advice with regards to what products you may need to use or are interested in starting. And we'll be offering a 10% discount if you use our Pigmentation 10 code on our online store. Okay, so with that, are there any questions? Let's have a quick look. Okay, so we have a question from one viewer, which is, are there any ingredients I should avoid in my skincare routine when I have pigmentation? That's a great one. So pigmentation tends to thrive on heat and inflammation. So I would be avoiding any harsh exfoliants, so anything that's going to aggressively scrub and strip back the skin. I would avoid any ingredients like salicylic acid, which can actually cause a little bit of heat in the skin as well. So we want to minimize any aggressive. Sometimes clients with pigmentation want to go too hard, too fast, and think that if they scrub the face aggressively, they're going to remove those pigmented cells, and that can actually have the reverse effect. So avoiding anything that's too harsh would be my advice for your skincare routine. It's all about suppression, hydration, anti-inflammatories. Okay, so what is the downtime with photorejuvenation? That's the next question. So with photorejuvenation, it's different for everybody, but the general rule of thumb is that the skin's going to look worse before it looks better. So for the first 24 to 72 hours, it's going to look a little bit like you've been sunburnt. There might be a little bit of redness. It will certainly feel a little bit warm, and you'll start to notice that the pigmentation, whether it be sunspots, freckles, age spots, will also start to appear much darker. So as time goes on, they look a lot darker. Around days 3 to perhaps 5 onwards, you start to notice that the pigmentation that we've treated will start to get a little bit dry, and it starts to form like a bit of a crust, like a micro crust. And what will then happen is day 5 onwards, you'll start to notice that that skin will start to flake away, and what will be underneath from 7 days onwards will be a smoother, more even complexion. Now, that's in a perfect scenario in a perfect world, but I've had clients before who have had their pigment turn around up to 2 weeks. So it does depend on the health of your skin. So by using your skincare products to prepare, you're definitely going to minimize the turnaround of your downtime, and also the age of your skin. So unfortunately, cellular age, the older that you are, the slower the healing capacity to your skin. So that can also have an impact as well. But with post photo rejuvenation, I should say too that we always ensure to stay in contact with you. So we'll touch base with you the next day just to see how you're going, and then again in a few days just to double check that everything's going to plan. Okay, so the next question is, what type of SPF should I use? So with regards to SPF, I find that the market and the marketing around SPF can be a little bit confusing. So SPF is a measure of how long you can wear the protection before needing to reapply. So when you're wearing an SPF 50, it doesn't mean that you're using the strongest form of SPF versus an SPF 30. There's only a small percentage, a very, very small percentage of difference with regards to the factor protection. So with regards to pigmentation, we always recommend the use of a SPF 30 and ensuring that it's a physical based zinc SPF. So the reason behind this is because zinc is a block. So when you've got a zinc SPF on, it basically acts like a shield and reflects all forms of UV. It doesn't let anything get through. Versus a chemical SPF. So a chemical SPF is slightly different in its functionality in that it works a little bit like a sieve. So it still allows the sun and the UV to absorb, but the chemicals in the SPF actually neutralize the UV in the skin, and that's how it minimizes sunburn from occurring. But what actually happens is that chemical process in the skin creates a lot of inflammation. And as we now know, pigmentation thrives and lives on inflammation. So the use of a chemical SPF can actually hinder and cancel out any potential results that you do get from your skincare and treatments. And generally speaking, an SPF 50 will be a chemical SPF because it's impossible to use zinc in its natural form and get an SPF 50. So that's why we only recommend an SPF 30, because we do know that it is zinc based. Now, Lyra use 21% zinc oxide in their SPFs, which is the highest percentage of zinc available. Okay, so I hope that answered that question, what type of SPF, and that is a SPF 30 zinc based. Okay, next question. Is there any way to make sure I don't get pigmentation in the future? Okay, cool. So obviously, as I just said, SPF is super duper important. And you definitely want to ensure that you're getting onto a pigment serum, such as the Pro Light, which we've just talked about. Hydration is also very, very important to ensuring the cell health, ensuring that your melanocyte is healthy as well. But the two main ones would be a pigment inhibitor and a good SPF, a physical zinc-based SPF. And obviously, you know, the list of controllable factors to eliminate those as well. Okay, so the next question, my doctor prescribed me hydroquinone. Is this a good product to use? Okay, so I'm so glad that someone asked about hydroquinone. Hydroquinone is a prescriptive-based cream. It's a compound that is recommended by mostly dermatologists and doctors. And the way in which it works is that it actually totally kills and destroys your melanocyte. So without your melanocyte, you're not able to produce pigmentation. But the problem is that it is actually quite toxic to the skin. So when you're using it, it will actually start to kill off other healthy cells around it. So you do start to see the degeneration of healthy tissues. It totally sensitizes the skin. So long-term use, you'll actually see a real sensitivity in your skin. You really can't get any UV or sunlight whilst you're using hydroquinone because it does become so sensitive. Any UV will cause the pigmentation to rebound. And quite often when clients stop using hydroquinone, that's exactly what happens, is that the pigmentation does return. So it's not really a solution that we recommend because it's just a short-term quick fix. And a quick fix can ironically be a long road to healthy skin. So we would recommend steering clear of anything that promises a quick fix and clearing your pigmentation completely. Okay, so the next question is there any way to make sure I don't get pigmentation in the future? So we covered that with the use of a pigment serum, with the use of a zinc-based SPF. What I would suggest to this client is that we'll get in contact and go through a prescription, what other products we would recommend, vitamin A and a vitamin C. Okay, so another question, which SPF is best for pigmentation? So again, a zinc-based SPF for the reasons just mentioned, something with a physical barrier. And the thing I love about Lyra's SPFs is that they've actually got a range of 3. So they've got a hydrating SPF. So for skin types that are really quite dry and dehydrated, it does some moisturizer and an SPF in one, and it's able to provide some amazing hydration. It has a classic SPF, which is for clients who generally don't want a lot of hydration but don't want the matte finish, so for combination skins that are sort of in the middle. It also has the tiniest bit of tint to it, which doesn't provide makeup coverage as such, but just helps to even out the skin tone. And then they have an oil-free SPF, which is totally matte and is one of our most popular products for clients with excessively oily skin, because it does go on so matte. It almost works a little bit like a primer if you are wearing makeup over the top. Okay, so a great question with regards to diet. So are there any types of foods to avoid increasing pigmentation? So food is not food as it was years ago. So our Western diet is overly processed and tampered with. So we always suggest, ensuring that where you can, eating organic, minimizing preservatives, ensuring that you're washing your fruits and vegetables to remove pesticides, avoiding sugars and over-processed foods, eating a really clean diet to help minimize inflammation within our gut health, and our internal organs will in turn minimize inflammation processes that occur in our skin as well. Okay. Is it possible to have different types of pigmentation, such as freckles and hormonal? Yes, absolutely. So the types of pigmentation are not exclusive to each other. You can most definitely have a combination of all types of pigmentation, actually. I have seen that before many times, and it does make navigating the treatment plan a little bit more difficult, because you may want to laser off your freckles. However, if there's hormonal pigment underneath or in conjunction to, the laser would cause the hormonal pigment to react adversely. So you do have to navigate your treatment plan a little bit more carefully. And in that case, I would recommend a course of chemical peels and LED, focusing more so on the hormonal pigment. And obviously a good home care routine as well. Okay, so the next question is, my pigmentation started when I was pregnant and it hasn't gone away. Is this normal? All right, so hormonal pigmentation it can be quite resistive to treatment. And once you've got it, it tends to be there. There are a small percentage of clients post-pregnancy and breastfeeding that may notice their pigmentation diminishes, but for the most part, it tends to be there and it lingers underneath the surface of the skin. So even after pregnancy, you need to be really mindful with wearing an SPF and continuing on with your pigment serums. But it is very normal. It is a type of pigmentation that is extremely stubborn and thrives on heat, absolutely thrives on heat and anything that you apply to the skin that's warm. So that's a very normal. Can pigmentations turn into skin cancer in the future? So definitely with regards to moles and lesions, in our practice, we avoid treating anything that is raised or suspicious. So we would recommend clients who are prone to skin cancers or do have anything that does look a bit suspicious to pop to a mole mapping centre and have their spots checked. With regards to laser, we always do a test patch first as well. Just to gauge the skin's response. Pigmentation can turn to skin cancer in the future, so it's something that you need to be mindful of, especially if you have that genetic predisposition. But from our point of view, we always ensure to be safe and not treat anything that we think may be suspicious. Okay. So the next question is it too late for treatment? I'm 43. So it's never too late to start treatment. You'd be amazed with the technology available to us, the ingredients, the delivery systems of those ingredients. We are able to make huge changes in the skin with regards to what's available to us. So it's definitely never too late. You know, Vicky, with regards to your question, we need to be realistic. You've had a lifetime of sun exposure, so there's not going to be any magic treatment or pill that's going to reverse 43 years of aging. Sorry, I've just said your age there. But certainly we can help to create some really good improvements with you. And this is something maybe we can speak a bit more privately in a consultation. So definitely here to help. Okay, are there any ingredients that shouldn't be used in conjunction when treating pigmentation? So anything with regards to ingredients, you should avoid using anything that is going to be too harsh, too hard, too fast. So any aggressive exfoliating, anything that causes any heat in the skin, you definitely want to avoid when treating pigmentation. It's all about suppressing the melanocyte, feeding it anti-inflammatories and hydrating the skin and protecting the skin with SPF. All right, so if there aren't any other questions, we might announce the winner of our Pro Light giveaway. Okay, one more question just before we announce the winner. It's a good one. So what's your option about the Cosmoline? So I'm really glad that this was asked. For those of you who aren't aware, Cosmoline is a depigmentation treatment that has become really popular of late. And basically it's a system that aggressively resurfaces the top layers of skin. So you experience about 12 weeks give or take, of excessive peeling and shedding and downtime, where we're removing the top layers that have been affected by pigmentation. So my opinion on this is that in the short term, you're going to see a result. That's great. You've removed those top layers that are presenting with the pigment. But what then happens deeper to the epidermis, deeper in the epidermis, sorry, to the melanocyte, is that because it's just gone through a really aggressive modality, the inflammation that's been triggered from excessively peeling back the layers of the skin kick-starts that melanocyte again, and it just kick-starts it to feed more and more and more pigmentation. So in the short term, you may get a result, but what will happen is down the track, and it might be 3 months down the track, it might be 6 months down the track, 12 months, it's different for everybody, but that pigmentation is going to come back, and it's going to come back with a bit of a vengeance because of the amount of the inflammatory sort of cascade effect that's occurred from the Cosmoline. So I think Cosmoline has its place, but if you're expecting a long-term fix with Cosmoline, you're definitely going to be disappointed. And we tend to avoid recommending Cosmoline only for that reason. Pigmentation is about the long-term management. Again, there's no quick fix. Okay, so next question. Having dark circles is part of pigmentation. So I'm assuming that you're referring to dark circles around the eyes. So around the eye area, that's a common concern. Dark circles around the eyes can be more so associated with certain nationalities. There's a genetic predisposition for there to be darker skin around that area. It can also be contributed to lifestyle factors, so obviously lack of sleep, diet related, and dehydration. So with dark circles, we can improve them, but if it is genetically linked, we obviously can't change your genetics. So what we can help you with is recommending a good eye cream, recommending some lymphatic drainage techniques to help with minimizing any puffiness. Certainly the eye cream will help with illuminating the just remembering again that, yeah, that genetic predisposition means that it's something that you'll, an eye cream is something that you'll have to use long term. How can we reduce scarring caused by chickenpox? Okay, good one. So with chickenpox scarring, I assume you're referring to the pigment and the discoloration. So I would suggest coming in for a skin consultation. We would then get you on a routine to help prepare the skin at home. And then once we start your in-clinic treatments, it would look something along the lines of some chemical peels and LED to take the colour out of that scarring and help reduce, suppress and minimise the discoloration. And then depending on if the chickenpox scarring is indented, because quite often it can be, we would get you started on some skin needling to help with smoothing out the indentations. How can I get skin like yours? Okay, so I get asked this a lot in the clinic from my clients, and my response is that as I've been working in the industry for over 10 years, from a young age, I always used amazing cosmeceutical skincare brands like Lyra. And I've always been really consistent with how I look after my skin. I never go into the sun, or I never put my face into the sun. I always wear an SPF, and I do my best to obviously have a healthy diet and lifestyle in moderation, but definitely I am always 100% committed to my skincare. And being in a clinic as busy as we are, we try and obviously have treatments as well, but I would definitely contribute my skin to my skincare. All right, so I think all of the questions have just about finished. So let's go back now and announce the winner of our competition. So I am extremely excited to announce that Kim Diofei is the winner of our Pro Light giveaway. So Kim, I'll be in contact after the webinar to confirm your address for delivery of your Pro Light serum and provide you with some instructions on how to use it. Yay! You're very, very welcome. I'm certain you're going to love it. All right, so I would just like to thank everyone for tuning in and watching. Thank you for your questions. Until next time, our next webinar, we'll speak again. See ya.